Have you ever noticed how the morning used to feel different? There was a time when you could get out of bed without thinking about your knees. You stood up, you walked, you lived. But now, the day seems to begin with a quiet negotiation with pain. You swing your legs over the edge of the bed, place your feet on the floor, and there it is, that familiar ache, stiffness, or sharp reminder deep inside the knee. And in that moment, a thought often crosses your mind. Is this just how it's going to be now? I want you to know something right away. Aging does not automatically mean surrendering to knee pain. I've spent decades in operating rooms, clinics, and rehabilitation wards, listening to stories from people in their 60s, 70s, and even 80s who believed their knees were worn out forever. Many were told they'd just have to live with it. Some were told surgery was inevitable. But what I'm about to share with you today has surprised even seasoned surgeons like myself. There is one simple, gentle exercise done every morning that can change the way your knees feel throughout the entire day. Not an intense workout. Not something that leaves you sore or exhausted. And certainly not something that risks injury. This is an exercise designed for aging joints, stiff mornings, and knees that feel fragile, but still have life left in them. Let me tell you about a patient of mine named Robert. He was 68 when he first came to see me, a retired school teacher. Proud, sharp-minded, but quietly frustrated. He told me his knee pain wasn't just pain, it was stealing parts of his identity. He stopped going on morning walks with his wife. He avoided stairs. He planned his day around how much his knees might hurt. He assumed this was the price of getting older. What he didn't realize was that his knees weren't failing him. They were simply being misunderstood. Here's what most people don't get told. Knee pain after 60 is rarely just about bad knees. It's about how the joint wakes up, how blood flows or doesn't into the tissues, how the muscles around the knee protect or abandon it, and how years of small habits quietly shape joint health. When you wake up in the morning, your knees are often stiff not because they're damaged beyond repair, but because they've been still for hours. The joint fluid is thick, the muscles are sleepy. The signals between your brain and your knee are slow to fire. And that is exactly where this morning exercise comes in. By the end of this video, you will understand why your knee pain feels worse in the morning, why many common knee exercises actually make things worse for seniors, and how one simple movement, done the right way at the right time, can gently tell your knees, it's safe to move again. You'll learn how to do it without stress, without fear, and without needing any equipment. Most importantly, you'll learn how to fit it into your morning routine so it becomes as natural as brushing your teeth. Now I want to be very clear. This is not a miracle cure. I don't believe in selling false hope. But I do believe in honest healing. And what I've seen again and again is that when people over 60 give their knees the right signal in the morning, pain often begins to fade, not all at once, but gradually, quietly, reliably. The kind of improvement that makes you stop and think one day, wait, my knees don't hurt like they used to. You might be wondering, why hasn't anyone told me this before? That's a fair question. The truth is, much of modern medicine focuses on fixing problems after they've become severe. Pills, injections, surgeries, those have their place. But the body also responds powerfully to simple, consistent signals, especially movement signals. Surgeons see the end stage. But healing often begins much earlier, with habits that seem almost too simple to matter. As we continue, I'll walk you through the logic behind this exercise in plain language. No medical jargon. No confusing anatomy lessons. Just a clear explanation of what's happening inside your knee, and why this one movement can make such a difference when done every morning. And later, I'll guide you step by step so you can try it safely, even if your knees feel weak, swollen, or unstable. So if you've ever felt that quiet fear about your knees, if you've ever wondered whether pain-free movement is still possible, or if you just want to start your mornings with less stiffness and more confidence, I invite you to stay with me. Now let's slow things down and talk about what's really happening inside your knees. Because understanding this is what takes away fear. Fear tightens the body. Understanding relaxes it. And relaxed joints heal better. Think of your knee like a well-designed hinge that depends on three main things to feel good: healthy joint fluid, supportive muscles, and clear communication with the nervous system. When you're younger, all three work smoothly without much effort. But after 60, changes begin not suddenly but quietly. Joint fluid becomes thicker overnight. Muscles that protect the knee, especially the thighs and calves, weaken if they're not used correctly. And the brain starts to interpret stiffness as danger, sending pain signals even when no serious damage is present. This is why mornings are so hard for so many people. During sleep, your knees are still for hours. Blood flow slows. Joint fluid settles. Muscles forget their job temporarily. When you suddenly stand up and put weight on the knee, it's like asking a cold engine to race immediately. The knee protests. Pain shows up. And over time, that pain teaches you to move less, which only makes the problem worse. One of the biggest myths I hear in my clinic is this: if my knee hurts, I should rest it as much as possible. That sounds logical, but for aging knees, complete rest is often the enemy. Another myth is just as dangerous. I need to strengthen my knees with hard exercises. Squats, lunges, stairs, long walks right after waking up. For some people, those movements can actually inflame the joint when done at the wrong time of day or without preparation. Here's the truth most people never hear. Your knees don't need force first. They need permission. Before strength comes circulation. Before circulation comes gentle movement. And before movement feels safe, the nervous system must be reassured. That's why the exercise I'm about to teach you works so well in the morning. It's not aggressive. It doesn't grind the joint. It doesn't push through pain. Instead, it sends a very specific message to your body. Wake up! Blood is flowing. The joint is safe. I've seen this play out countless times. I remember a woman named Helen, 72 years old, who told me she dreaded mornings more than nights. Nights were quiet. Mornings reminded her of everything she couldn't do anymore. When I showed her this concept, starting the day by gently waking the knee instead of challenging it, she was skeptical. She said, "Doctor, this seems too easy." 2 weeks later, she came back smiling. Not because she was cured, but because mornings no longer scared her. Her pain didn't vanish overnight, but it stopped controlling her first steps of the day. Another important point: pain does not always mean damage. Especially in seniors, knee pain is often a signal of stiffness, poor circulation, or muscle imbalance, not necessarily bone-on-bone disaster. When you respond to pain with fear or total avoidance, the nervous system amplifies the signal. But when you respond with calm, controlled movement, the nervous system often turns the volume down. This is why timing matters so much. Doing the right movement in the morning can reduce pain for the entire day. Not because it magically heals cartilage in minutes, but because it improves lubrication inside the joint, wakes up stabilizing muscles, and resets how your brain interprets knee movement. And let me bust one more myth while we're here. Age alone is not the problem. I've seen 80-year-olds with better knee function than some 55-year-olds. The difference is not luck. It's how the joint is used, protected, and gently challenged over time. In the next part, I'm going to guide you through practical steps you can use every single day. I'll explain the exact exercise, how to do it safely, how long it should take, what it should feel like, and what it should never feel like. I'll also share a few simple habits that quietly support knee healing without pills or complicated routines. Stay with me because this is where knowledge turns into relief. Now let's move into the part that truly matters: what you can do starting tomorrow morning to give your knees a better day before it even begins. I want you to listen to this not as instructions but as reassurance. Nothing here should feel rushed, nothing should feel forced, and nothing should ever feel painful. When you wake up in the morning, before you stand, before you walk to the bathroom, before the knee has to carry your body weight, that is the golden window. This is when the joint is stiff, yes, but also when it is most responsive to gentle signals. The exercise itself is simple. You can do it lying in bed or sitting at the edge of the bed, one leg at a time. You slowly straighten your leg until it feels comfortably extended, not locked, not strained. Then you gently tighten the muscle on the top of your thigh, just enough to feel the knee supported. Hold that gentle tension for a few seconds, then relax and slowly lower the leg. That's it, no jerking, no speed. Just calm, controlled movement. What should it feel like? It should feel warm, awakening, almost like oil spreading inside the joint. You might feel mild stiffness releasing or a light pulling sensation in the muscles. What it should not feel like is sharp pain, burning, or pressure deep inside the knee. If you feel those, you're pushing too hard, and that's not the goal. Do this slowly 5 to 10 times on each leg. Breathe naturally. Don't hold your breath. This isn't about discipline. It's about communication with your body. You are telling your knee, "I'm listening to you." Once you finish, take a moment before standing. Notice how your knees feel compared to when you first woke up. Many people are surprised right here. The first steps often feel lighter, less guarded. Not perfect, but different. Better. Now let me share something just as important as the exercise itself. What you do around it. Small habits can either support this process or quietly undo it. One common mistake is jumping straight into demanding activity after waking up. Long walks, stairs, or chores before the knee is ready can bring pain right back. Give your knees a few minutes of gentle movement before asking them to work. Another mistake is comparing yourself to others. Healing is not a race. Your knee has its own story, its own pace. Hydration matters more than people think. Joint fluid depends on water. If you wake up dehydrated, your knees wake up dry. A glass of water in the morning is a simple but powerful support. Nutrition also plays a quiet role. Consistent protein intake supports muscle around the knee. Foods rich in natural anti-inflammatory compounds like leafy greens, berries, and healthy fats help calm irritated joints over time. Footwear matters too. Slippers with no support or walking barefoot on hard floors first thing in the morning can strain an already stiff knee. Give your joints kindness where you can. And finally, mindset. This may surprise you, but it matters deeply. If you approach movement expecting pain, the body often delivers it. If you approach movement calmly, with patience and respect, the nervous system responds differently. I've seen it time and time again. The body listens to how you speak to it. This daily practice is not about fixing everything at once. It's about consistency. 5 minutes every morning can do more than one intense session once a week. Knees respond to gentle repetition, not punishment. In the final part, I want to talk to you heart to heart about hope. About what I've seen change in people who thought their best days of movement were behind them. And about how this simple habit can quietly give you back confidence in your own body. Before we finish, I want you to pause for a moment and imagine something simple. Imagine waking up one morning and realizing that you didn't think about your knees right away. Not because they disappeared, not because you became young again, but because they didn't demand your attention. That quiet absence of pain is something many people over 60 believe is no longer possible. But I've seen it return softly in people who once felt hopeless. I want to tell you about why this matters beyond joints and muscles. Knee pain slowly shrinks life. It makes people hesitate. It makes them say no to walks, trips, playing with grandchildren, standing a little longer in the kitchen. Over time, it doesn't just affect movement, it affects confidence. And confidence is one of the most important medicines we have. What this simple morning exercise really does is restore trust between you and your body. Every gentle repetition tells your nervous system, I can move without danger. Every pain-free step afterward reinforces that message. And slowly, day by day, fear loosens its grip. When fear fades, pain often follows. I've watched patients who once clutched handrails begin walking freely again. I've seen people who avoided mornings start looking forward to them. Not because everything was perfect, but because they felt in control again. That sense of control is powerful. It changes posture. It changes breathing. It changes how you move through the world. Remember this, your knees are not broken machines. They are living tissues that respond to care, patience, and consistency. You don't need to push harder. You need to listen better. And every morning gives you a new chance to do that. If there's one message I want you to carry with you, it's this. Improvement after 60 is still possible. Not through extreme measures, but through respectful, intelligent movement. The kind that honors where you are today, not where you think you should be. If this message resonated with you, take a moment to support this channel by liking the video. It helps more people find guidance like this. Subscribe if you want calm, honest conversations about aging well and protecting your body. And if you feel comfortable, share your experience or your questions in the comments. You're not alone in this, and your story might help someone else take their first pain-free step tomorrow morning. Take care of your knees. Take care of yourself. And I'll see you again soon.